Hello everyone. Here I am going to talk about the gross features of urinary bladder. This section includes the location of the bladder, its external features, relations, interior of the bladder and blood supply. Coming to the location, what you're saying, this is the sagittal view of the male pelvis. Okay, this is the anterior aspect. This is the posterior aspect. Posteriorly you can see the sacrum with the coccyx. Here anteriorly there is the pubic symphysis is there. See, this is the bladder. Your bladder can see. So it lies in the anterior part of this lesser pelvis, behind this pubic symphysis. Okay. Then see, this is the superior aspect, superior of this urinary bladder. This part, forms the base. Here, this is the neck. In adults, this neck lies 3 to 4 centimeter behind this lower border of the pubic symphysis. Okay. In infants, the urinary bladder is abdominopelvic. Okay, and the neck lies behind the upper border of the pubic symphysis. Okay. Yes. Then coming to the external features of the bladder. So this urinary bladder is a muscular organ which acts as the reservoir of urine. Okay. Then the size, shape and position of the bladder varies according to the amount of urine it holds. When empty, it is tetrahedral in shape. See the shape. When empty, it is tetrahedral in shape. When it is filled with urine, it is ovoid, okay, and extends up to the abdominal cavity. The average mean capacity of the urinary bladder, that is the 220 ml. Okay, when it is filled just beyond this 220 ml, there is the desire of the micturition. Okay, but it still has a capacity of 500 ml. After that, pain sensation starts. Okay, so the shape of the bladder, that is empty, it is tetrahedral in shape. Okay, we'll explain the external features according to this. Here, this is the lateral view. This is the anterior aspect. This is the lateral view. Here, this is the posterior aspect. Okay, so anteriorly, this part, this is the apex of the bladder. This part is the apex of the bladder. Posteriorly, you can see this is the base or the fundus of the bladder. That forms the base or the fundus of the bladder. Here, you can see this is the neck of the bladder. Neck of the urinary bladder. Then, there are superior and infralateral surfaces are there. See, this is a superior surface which faces upwards. This is a superior surface. Okay. Then here the superior surface is demarcated by here. Inside there is the lateral border. That is the lateral border. So this is the lateral border. Then here this surface, what you're seeing, this is this surface. This is the infralateral surface. See, this one is the lateral view. So this is the left infralateral surface. This is the the other side. There is the right infralateral surface is there. So this right and left infralateral surface, okay, separated by a border there. This is the anterior border. Here we'll get this one, that is the anterior border. Okay, then the superior surface is separated from the base by, there is a border there, that is the here we'll get the posterior border. This border, that is the posterior border, separates the superior surface from this base or this fundus. Okay, so the features here, this is the apex, this part is the base, this part is the neck. The surface here, this is the superior surface. These are the lateral borders. See here, this is the anterior border. See, this is the infralateral surface. The other side, right, also there is the infralateral surface separated by an anterior border. The base is separated from this superior surface by there is the upper border. Okay, so these are the borders and surfaces of the bladder. Then here also you can see this is the bladder. Here this is the neck. Here this is the prostate. What you're seeing here, this is the prostate. Okay, prostate, you can see this in the males. So this is the bladder. See the shape of the bladder. This is the bladder. Then here you can see here, this is the apex, this part forms the base, this is the lateral border, this is the superior surface, this is the infralateral surface. Okay, here this is the base. Some structures you can see in the base, that is the seminal vesicle, then there is the vas deferens, then ureter is there. Okay, so this forms the neck. Here you can see this the prostate, okay, in males. Then coming to the relations. Here again this is the sagittal view. Here this is the anterior aspect. You can see the pubic symphysis. This is the posterior. You can see this the rectum there. See, this is the bladder, can see here. Then see, this part is the base of the bladder. Here this is the neck of the bladder. Its neck relates to this prostate in males, and females here it relates to the pelvic fascia. Okay, pelvic fascia. Then neck, that part is pierced by this here. You can see there is an internal urethral orifice is there. From there the urethra starts. Okay, from here this is the internal urethral orifice there. Then see, this is the this surface here. This is the infralateral surface. That is the infralateral surface. Then in this figure it's more clear. See, this is the again this is the sagittal view. This is the anterior aspect. This is the posterior. You can see the sacrum and the coccyx. This is the rectum there. The urinary bladder is there. Okay. So this surface, this is the superior surface. Okay. The superior surface is covered with peritoneum. Okay. Then, and it relates to the coils of the intestine, and this sigmoid colon is there. And also here, the peritoneum here, peritoneum of from this rectum is reflecting towards the superior surface and forms there is the pouch that is called the rectovesical pouch. Here this pouch is the rectovesical pouch. Okay, this peritoneum from this rectum, okay, to this superior surface is reflecting to the superior surface of the bladder and forms a pouch, okay, between this urinary bladder and the rectum. That is the rectovesical pouch. Okay. Then see, this part is the base of the bladder. Okay. The base of the bladder is separated from this rectum. Here this is the rectum, this is the base. It is separated from the rectum here by a fascia, that is called, here you can see a fascia there, that is called the rectovesical fascia or the fascia of Denon-Villers. Okay, the fascia of Denon-Villers. Okay, rectovesical fascia or the fascia of Denon-Villers. Okay, then see here, this is the infralateral surface. Okay, on both sides. Okay, right and left, the infralateral surface is there. Okay, the infralateral surface is relates to here. There is the retropubic fat. Okay, here we'll get here. There is a retropubic fat. That space here between the body of the pubic symphysis and this urinary bladder, here we'll get a space. That space is called the space of Retzius. That is called the space of Retzius. There will get this retropubic fat. Then puboprostatic ligaments. Then there is the pubocervical ligament in case of females. Then also vesical venous plexus there. Okay, then we'll get this each sides. There is the levator and obturator internus muscle is also there towards this lateral pelvic wall. There is the obturator internus and the levator muscle is there. Okay, so this forms the superior surface. This is the infralateral surface relations. Okay, then here there is the base. Okay, then here the base is related to some structures. You can see here, this is the prostate. This one is the prostate. This here you can see, this is the urinary bladder. Okay, this is the view from behind. Okay, this is a view from behind. Here, this is from here, we'll get this here, the neck of the bladder. Okay, see, this is the, here, this surface, this is the superior surface. Here, this is forms the, this is the apex. This part, this is the base. Okay, here it's, you can see here there is the vas difference or the ductus difference. You can see this part is the ampulla. Then lateral to that, here we'll get this is the seminal vesicle is there. Okay, so this base is related to this seminal vesicle. Then medially there is the ductus difference or vas difference. Okay, base its lateral sides there we can see this the ureter. The ureter is piercing. Okay, at the lateral sides of the supralateral of this bladder. Okay, so that's the relations of the base. Then here in females, see here, this is the anterior aspect, female pelvis. This is the posterior. You can see this the sacrum coccyx rectum there. Okay, see this the urinary bladder. Urinary bladder. This is the superior surface. Superior surface relates to the coils of this intestine. Then sigmoid colon there. Then you can see here also there is the uterus. Okay, it's the body of this uterus. Okay, towards the superior surface. Okay, peritoneum from here, the superior surface is reflects towards this isthmus, till the level of this isthmus of the uterus. There it forms a pouch here. This is called the vesico-uterine pouch. Okay, this pouch here, this is called the vesico-uterine pouch here. Okay, then here you can see here we'll get this is the base of the bladder. The base of the bladder is relates to the cervix and this upper part of this vagina. This is the vagina. So base is relates to this cervix and this upper part of the vagina. Okay. So these are the relations in males and females. Then coming to this interior of the bladder, what you're seeing here, this is the frontal section. Okay, here you can see this is the bladder. This is the urinary bladder of male. Here you can see this is the prostate is there. See, this is the, here you can see the muscles. This one is the levator trainae. This is the obturator internus. It relates to this infralateral surface. Okay, see here this part is the neck of the bladder. From here, this orifice, this is the internal urethral orifice. Urethra starts. Then in the interior, there are temporary mucosal folds. Okay, you can see this mucosa is irregular. Okay, these are the temporary mucosal folds. When the bladder is full, this mucosa gets distended and this folds disappear. Okay, see in the lower part of this base of the bladder, see here, this is the base. This is the anterior view, front view. Here in the lower part of the base of the bladder, we can see there is a triangular region. See this triangular region. This one forms the trigone of the bladder. That is the trigone of the bladder. See the trigone, it has an apex which points downwards, and this part is the base of the trigone. Okay, see here in the lower part of this base of the bladder, there is a triangular region here. This is forms the trigone. It has apex. Okay, then this part that forms the base of the trigone. Okay, then apex is facing downwards. Okay, faces downwards. Okay, then here the mucosa is smooth. Okay, the remaining region, its mucosa is irregular. Okay, there it's loosely attached to this muscle layer of this urinary bladder to the detrusor layer by means of some connective tissue. That's why the mucosa is irregular. Here the mucosa is smooth. That means the mucosa is closely attached to the muscle layer. There is no submucosal layer in this region. That's why here the mucosa is smooth. Okay. Then see the base. See the base. It is the base. You can see there is it's formed by interureteric ridge here. This is the interureteric ridge. See, you can see in the lateral there is ureteric orifice. Here there is the opening of the ureter. So interureteric ridge is produced due to the continuation of this inner longitudinal muscle of this ureter. Okay, this interureteric ridge, or also called the, this is the bar of Mercier. Okay, here this is the bar of Mercier's bar. Okay, or the interureteric ridge that forms the base. So in the lateral angles, there will get the ureteric orifice. Okay. Then coming to this apex, okay, there you can see this urethral orifice is there. Just above and behind this, there is an elevation called, here you can see there is an elevation called, this part is called the uvula vesicae. That is called the uvula vesicae. Okay, you can see this is the uvula of the bladder. Okay, this elevation is due to the median lobe of the prostatic gland, and if the median lobe is enlarged, it will obstruct this urethra, okay, and got distorted, giving rise to a condition that is called the benign prostatic hyperplasia. Okay, that's all about this interior of the bladder. Okay, here also you can see the same figure. So here, this is the mucosal folds will be irregular. Here the lower part, this is called the base, that is called the trigone of the bladder. See the lateral angles of the trigone, there you can see the opening of the ureter. This is called the interureteric ridge, or this Mercier's bar. This is the apex of the trigone. Okay, there you can see there is the orifice, internal urethral orifice starts, then there will be an elevation behind that, that is called the uvula vesicae. Here we'll get the uvula vesicae. The trigone, the mucosa is smooth, the remaining areas mucosa is irregular. Yes. Then coming to the ligaments of this bladder. There are true ligaments and false ligaments are there. Okay, these true ligaments, these are the condensation of this pelvic fascia. The false ligaments, these are peritoneal folds. There are 9 true ligaments, okay, and 7 false ligaments are there. In this figure, you can see these are the true ligaments. Okay, this is the horizontal section through this pelvis and the view from below. Okay, then see here, this is the posterior. You can see this is the sacrum is there. This is the rectum. This is the anterior aspect. This is the pubic symphysis is there. Here, this is the urinary bladder. This is the cervix of this uterus. So this is the female pelvis. Okay. Here, toes anteriorly. Okay. You can see there is the medial and lateral puboprostatic ligaments. In case of females, there is the pubocervical ligaments. Okay, that is the pubocervical ligaments. In males, it is medial and lateral puboprostatic ligaments. Okay, this medial and lateral puboprostatic ligaments is from the neck of the bladder to this pubic symphysis, to the inner aspect of this pubic symphysis. Okay, from the neck of the bladder to the pubic symphysis. Okay, then there is a lateral ligament is there. Lateral ligament. Okay, see this here. This is the pelvic wall. Here you'll get one muscle is there here. Here we'll get one muscle. Here this is the obturator internus. Here we'll get the obturator internus. Then this is the tendinous arc of this obturator internus muscle. Okay. Here, this is the obturator internus. This one is the tendinous arc of the obturator internus. Here we'll get the muscle. Okay. So this lateral ligament, that is from the infralateral surface of this urinary bladder to the anterior of this tendinous arc. To the anterior of this tendinous arc. This lateral ligaments. Okay. Then there is the posterior ligament is there. See, you can see this is the posterior ligament. Okay, this posterior ligament is from the each sides of the base of the bladder, from each sides of this base of the bladder to this lateral pelvic wall, to the lateral pelvic wall. Okay, so these are the true ligaments. These all are paired. Okay, additional to that, there is a median umbilical ligament is there. Okay, median umbilical ligament, that is from the apex of this bladder to this umbilicus. This is the remnant of the urachus. Okay, this median umbilical ligament. Okay, these are the medial and lateral puboprostatic or pubocervical ligaments. Okay, true ligaments, these are the condensations of the pelvic fascia. Then coming to this false ligaments. Okay, here you can see these are the false ligaments. Then those are the peritoneal folds. Okay, see, this is the bladder, can see. This is a view from behind. Here you can see the prostate relates to the neck. This is the superior surface. This part forms the base of this urinary bladder. See here, this is the anteriorly. This is the anterior abdominal wall. Okay, so there is a peritoneum lines from the superior surface of the bladder. It reflects towards the lower part of the anterior abdominal wall. Then it forms some folds there. Okay, in relates to this bladder. Those are there is a median fold. You can see a median fold. Then there is a medial fold. This is the medial fold. This is the medial fold. And also there is a lateral fold is also there. Lateral fold. Okay, so this medial fold, okay, is due here. There is the median umbilical ligament is there, the medial fold from the apex to this umbilicus, it's attached. Then see, this is the medial fold. Medial fold, it contains this obliterated umbilical artery. So this median and medial fold relates to this ligaments of this urinary bladder. Okay, then here, additional to that, there is from this sides of the base of the bladder, a ligament goes posteriorly to the third sacral vertebra, third sacral segment, that is called the sacrogenital folds or the sacrogenital ligaments. These are the sacrogenital ligaments. Okay, this is also false ligament. Okay, then there is a lateral false ligament from the lateral surface to the pelvis. Okay, there is the lateral false ligament, and there is the sacrogenital ligaments. That also comes under the false ligament. Okay, that's all about the ligaments of the bladder. Then coming to this blood supply. Here the arterial supply. Here you can see this is the common iliac artery. Here you can see this is the common iliac artery. This is the external iliac. See, this is the internal iliac. It is giving branches to the bladder. This is the, here you can see this is the superior vesical artery. This is the obturator artery. See here, this is the obturator artery. This one, that is the inferior vesical artery. Okay. Additional to that, in females, there is the branches from this uterine and this vaginal artery. This also provides supply to this urinary bladder. Okay. Then venous drainage, along with the arteries, veins accompanies. Then those veins drains into this. Here you can see this is the obturator veins. Here I will get the superior vesical vein. This is the inferior vesical vein, which finally drains into this. This is the internal. Here you can see this is the internal iliac vein. Okay, venous drainage to this internal iliac veins. Okay. Then lymphatic drainage to this common iliac and internal iliac lymph nodes, to this common iliac and the internal iliac lymph nodes. Okay. The nerve supply, that is sympathetic by this T11 and L2 segments of the spinal cord. Then the sympathetic innervation causes relaxation of this detrusor muscle of the urinary bladder, promoting urine retention. Okay. The parasympathetic, that is by the S2, S3 and S4. Okay. So this parasympathetic innervation, this contributes the contraction of this detrusor muscle, stimulating micturition. Okay. That's about this nerve supply. That's all about the features of the urinary bladder. Okay. Briefly describe the urinary bladder under the following headings, that is the external features. Okay. According to this in the empty bladder. Okay. That is tetrahedral in shape, which are the parts of that. Okay. Then its relations. Okay. Relations in male and female. Then interior of the bladder, what you can see interiorly, about this trigone. Okay. Also, and the remaining part of this mucosa. Then ligaments, which are the true ligaments and the false ligaments. Then the blood supply. Okay. Thank you.